Welcome to Straight Outta Health IT. Getting into health tech is rough, but here's an unfiltered dialogue of healthcare leaders and influencers covering a wide variety of issues affecting healthcare and the health tech industry. And now your host, Christopher Cunny.
Hello, everyone. This is Christopher Cunny again, and welcome to another edition of Straight Outta Health IT. I'm again very excited to have on the show today one of my all-time favorite healthcare technology leaders and innovators and disruptors in the marketplace today, who's going to spend some time with me on a topic that's near and dear to my heart, which is rural health. Many of you probably don't know, I'm actually a country boy. I grew up in a small southern town in southeast Georgia, and I saw the impact of healthcare on that community and specifically with my family, most recently with, unfortunately, the untimely death of my brother-in-law who died of COVID, and also going through the journey with both my parents who both are now deceased. So without further ado, I'd love to introduce all of you to a friend and colleague, Mr. Michael Archuleta. And so before I bring Michael on, let me just give you a quick rundown of his accomplishments. And trust me, I'm not covering nearly all the things that he's done in his career, but let me share just a few. Michael was recognized as a top hospital and health system CIO, and he was also named a rising star in healthcare. Michael is cutting-edge, innovative, visionary leader who possesses strong leadership skills and extensive experience and proven track record for driving increased levels of productivity, profits, high integrity and customer relationship skills, and an expert problem solver and decision maker. Michael is an active member of the College of Healthcare Information Management Executives, or CHIME, a technology and cybersecurity advisor for several startups, and an active speaker in the field of health information technology. He also has been recently appointed by the governor of Colorado to serve as commissioner of Colorado's eHealth Commission, which provides advice, guidance to the Office of eHealth Innovation on advancing health information technologies in his state. Under Michael's guidance and leadership, Mount St. Raphael Hospital became one of the leading hospitals in the state of Colorado for leveraging advanced technologies to enhance patient and provider experiences. Michael's innovative driven approach led the hospital to HIMSS Analytics Stage 6 recognition on an 8-stage HIMSS Analytic electronic record adoption model, a feat only reached by about 30% of hospitals in the US. Leveraging advanced information technology to improve value-based care in the areas of infrastructure, business, administrative management, quality, safety, and clinical integration. Department has also been presented the 2015, 2016, 17, 18, 19, and 20 Healthcare Most Wired Awards, which is given annually to top hospitals in the country, making the most progress in adoption of information technology. Michael's leadership at San Rafael has recognized him as one of the best leaders and has achieved the most wired survey status. He's also a former veteran, so thank you for your service. And welcome to the show, Michael Archuleta. Hello, Michael. How are you today?
Hey, good. Chris, how are you doing, man? Really honored to be here, and thank you again for the invite.
Oh, no, it's my pleasure and my honor to have you on the show. I mean, you clearly have made such an impact on the healthcare community that you serve through your leadership and visionary drive to really take advantage of technology, part of the care delivery process. And before we get started in the discussion around rural health, I wanted the audience to hear a little bit more about you and your journey and your road to becoming a CIO. So maybe you could take a few minutes and sharing that path with us.
Yeah, absolutely. Basically, I really came from a humble beginning. First individual from my family to become college educated. Grew up in the ghetto, family in the projects. So I really learned a lot about grit, determination, and really showing that education can really take you anywhere that you basically would want to go. So at the time, I was unfortunately getting in a lot of trouble it wasn't a good scenario because I had a lot of good friends that either ended up in prison, some
Sure.
passed. And it was one of those items I remember just outside. We lived, well, they called them the bricks, but I was outside and just looking. And I really thought to myself, I said, man, I'm not doing good in school. I'm getting in trouble. I honestly don't even know what I'm going to do with my life.
Exactly.
And I really thought to myself, I said, I need to really make a change and a difference. So at the time, my mother, she was married to an individual. He had a cattle ranch,
Uh-huh.
which was about an hour southeast of where I grew up here in Trinidad, Colorado.
Right.
So then I remember my mother saying, well, guess what? We are moving to a town, Branson, Colorado, population of 100 individuals, and you're going to be going to school there.
Talk about
I
roll
remember
call.
extremely upset. So you figure, yeah, I was leaving my school my 8th grade year, and I was
Right.
going to start 9th grade year over in this small cattle ranch little community.
Mm-hmm.
I mean, 100 individuals. It was going to be impossible for me to come into town quite often just because of the distance and the gas.
Exactly. Everybody knows everybody, so whatever you do, you can't hide it because somebody saw you and tell your parents.
You couldn't hide it, but overall, I always thank my mother for really moving in that direction because that
Absolutely.
school that moved really saved my life moving forward. I really didn't have anything to do. So again,
Mm-hmm.
I said, well, the only thing that I have to do is pick up a book and start studying and learning. So then when I started learning, picking up these books, and I started doing extremely well in school
Right.
after, I was like, man, I didn't know I had this in me.
Yeah,
So then I excelling and excelling. And then at the time, the school was basically embargoing in an overall online digital presence. So since the school was so small,
right.
they needed to determine a way on how to create more funding for the overall education system. So then the school started the very first, it was called Branson School Online. So then they started this big online schooling, which then basically brought in a lot of revenue to the brick and mortar building in our school and everything. And I remember that they bought a computer for everyone in the entire school. So that was
wow. So everyone shared the one computer.
Yeah, I mean, everyone. Well, at the time, everyone received a free computer from the school.
Right.
So it was pretty amazing because you figure back then our computers were all in basic classroom settings, and then there were Macs, the old Apples,
right.
And only really play was the Oregon Trail, which I loved. I don't know if you remember.
I remember exactly.
So they bought a computer for everyone. And then that's when I really started getting into learning about coding. And then they started talking about some computer science initiatives and really just kind of having a passion for technology. And I was like, man, I really, really enjoy this. But I think, again, the overall just the humble beginnings, going from the projects to college graduating to then, starting and working in the healthcare industry, which I never thought I was going to basically work in, because honestly, when I was a kid, I was always terrified of needles,
right.
And it's kind of, I have several tattoos and they're like, man, you're terrified of needles. I still am, because it was just like a scary thing when we were kids. So they poke us up. I was like, man, this is. But then I started working in healthcare, and see, when I came into this organization, it was interesting. So this is when the Affordable Care Act was basically pretty dominant.
Exactly.
So of course, the HITECH Act, the Health Information Technology and Economic and Clinical Health Act, really started basically coming up with the American Recovery and Reinvestment Act.
Right.
So a lot of these facilities, a lot of these healthcare facilities that have always been on paper had to now have an electronic presence. Exactly. So then they had required to implement an electronic medical record system. And then on top of that, another little caveat that they said is, okay, you have to adopt an electronic medical record by this specific date. in order to maintain your existing Medicaid and Medicare reimbursement levels. Plus, you have to also adopt and demonstrate meaningful use.
Right.
We're like, okay,
Yeah, what the heck is that? Yeah.
meaningful use. So, they were kind of explaining, okay, well, meaningful use of the electronic medical record system basically defined, it shows how an organization is improving quality, safety, efficiency, and really reducing health disparities.
Right.
The overall measures showed, how you can really engage with patients and family, improve care coordinations and population health, really maintain privacy and security of the patient health information. But the problem is that this organization was always focused on paper, and they never had a good digital strategy in place. So when I came in, and I love to share these before and after pictures,
Sure.
maybe we can read that into the podcast, and I still have them. So when I came in, when everything was basically required, my first task was, okay, you're responsible for implementing the electronic medical record system. You're responsible for hiring and building the first IT department, and you're responsible for adding in an ambulatory EMR system. And I said, okay, well, I'm always willing to take on
challenge. Yeah, up for the challenge.
Individuals like, hey, let's do it. But then when I came in, the first thing I wanted to do was I hired a consulting group because the organization was so behind the curve with technology advancements that we had a specific date that we had to go live with the EMR. Right. And if we did not meet that specific date, we were going to be penalized as an organization. And I was like, wow, this is going to be interesting. And I kind of at first, honestly felt that, maybe they hired me to be kind of like their scapegoat. Because this thing isn't going to take off. And if something happens and the organization starts getting penalized, right, and they start losing their overall existing Medicaid and Medicare reimbursement levels, they're going to put it on me because it was my fault.
Right. And I just wanted to stop you there for a second. It's so interesting now to see the transition that's happening. Those initial first investments in electronic health records were driven by the CIO of those organizations. And now as they've evolved, you see more clinical leaders start to drive those initiatives as well, too. But the CIOs were very much on the forefront of taking the hits associated with the successful implementation of these platforms.
Oh, absolutely, man. And I fully agree with you. So then going back to that, I hired a consulting group to basically come out to the organization and really looking at the technology, looking at the staff that wasn't in place, looking at the specific modules that were basically required to implement. So at the time, we had these housekeeping closets. They call them spaghetti rooms because you had so much network cable that was unmanaged and undocumented that it was absolutely disgusting, man. It was like, how could you find anything? And then some of their systems that they had in place that I inherited, and some of their critical systems had 59% uptimes. There was servers and housekeeping closets. There was switching housekeeping closets. There was legacy hardware and software, legacy firewall, home grade wireless access points.
Right. Oh my goodness.
Backups. There was no disaster recovery, no data center, no standardization, no centralization. There was no redundant power. And
no security. No security.
It kept on going and going, like no network redundancy, no cable management. And then what was scary too was that there was no cybersecurity focus.
Exactly.
So then when I got the consulting group to basically come in, they came back. I remember we were all in a board meeting and basically, we wanted to kind of see what the results were for going live, building this overall program, installing these electronic medical record systems in place. So the group came back and said, well, you guys want to go live by this specific date. You have a 20% chance of successfully going.
Oh my God. That's insane.
I was like, ouch.
Yeah,
we have
absolutely insane.
Going live. I said, this is absolutely insanity.
Yes.
At the time when I heard that, I really questioned if I should continue this journey or not.
That's right. Yeah, talk about a poor bet, right, of success. Oh my God.
It was because at the end, I was like, if I don't pull this off, I'm probably going to get blamed for the penalties and I'm probably going to end up getting fired.
Right.
But if I do pull this off, this is going to be just an amazing project. This is going to be an excellent success for the organization, myself. And I said, we're going to move forward with this.
That's great.
So I remember establishing the first team, man, getting it done. I want to incorporate this before I tell you exactly, what we did with our first data center. But
Sure.
I've always put in the no nonsense framework. That's what I've always had in my overall focus.
Right.
I said SD, being a GSDer is the no nonsense framework. And we have to establish that in our overall process, in our business life, in our professional life, in our personal lives, everything that we do. And there's two different types of people, and you know this too, Chris, because you're a GSDer. But there's individuals that talk, and no actions.
Right.
There's never action in regards to that. But then you have the GSDers, the no nonsense framework that is what I'm established on. And people ask, well, what is the GSDers? What's the GSD community? I said, you know what, ladies and gentlemen, the GSD community is the getting shit done community. And that's what we move forward with too. Bottom line. So then when I came in, I said, let's do this. We got to, day, night, we worked. We hit all of the initiatives. We went live the specific date that we needed to. We installed all of the applications for the electronic medical record system. We added in a lot of virtualization efforts. I built the very first data center. We went from a 59% uptime to a 99.9% uptime. We went physical servers to 99% servers being fully virtualized. We went from physical desktops to 90% desktops being virtualized. I added an all-flash FAS solution. I put in a brand new generation firewall. There was enterprise wireless systems throughout the organization. Wow. Finally, redundant power management, full automation, cable management, standardization, centralization, and we finally had redundant networks in place. And just by adding virtualization efforts, I was able to reduce costs,
right?
6% and improve uptime from 59% to 99%, which increased business productivity, operating efficiencies, and really enhanced services while reducing operating expenses.
That's great. And you did that all. And you did that all while you were taking the organization through a whole clinical transformation effort with the implementation of an EHR.
Absolutely, doing all that. So again, there was a lot of pride in our overall process because honestly, you look at the healthcare industry and it has. Our brave doctors and nurses have worked in inefficient legacy systems from the 1940s.
Exactly.
And it's such a sad thing, man, that you would think we would be the leaders and the pioneers of digital transformation. But, we're many years behind the curve when it comes to transformation. And then honestly, too, it's like the CIO, the chief technology officer, the chief data officer, the CMIO, those aren't the individuals that changed the acceleration of digital transformation. It was basically COVID-19. That's what really boosts acceleration of what we're basically.
That's right. And even just the adoption of the electronic health record system, it wasn't until the carrot and the stick was put out there by, starting with the Bush administration and then doubling down with the Obama administration, that health systems were even making an investment in the adoption of electronic health record systems, primarily because, there wasn't this mandate that said, if you don't become more digitized, we're going to penalize you financially.
No, exactly. And then just exactly what you stated, that, a lot of the healthcare delivery is still, in my opinion, it's still in early stages of extraordinary changes. This change, again, was really being driven by the relentless movement to the value-based care model.
That's right.
And the problem exposed by the COVID-19 crisis too. And I mean, that's really what we're seeing moving forward. But again,
yeah, I just want to first of all commend you on that monumental effort to transform that health system. It's not just the technology to a certain degree is the easy part. It's getting people on board with adopting the technology and leveraging it in the most efficient ways possible. That sometimes is the hardest lift in anything else, and convincing your leadership to make that kind of investment in the platform, the infrastructure needed to support the platform they had to use to provide better care. That's an amazing accomplishment. And so you should be applauded for your efforts as a transformational leader, and the leadership there for being willing to support you in that journey.
Absolutely, man. And I appreciate that. Thank you very much.
Cool.
Again,
I like it, and I like the terminology. Get shit done. Yeah, I'm start using that as well too.
Oh man, yeah. I always I tell my just everyone around me that is a no nonsense framework
there you go.
that I've adopted in my overall professional career, in my life, anything that I do moving forward.
That's great. And shout outs to your mom, by the way, as well, for taking the leap to take you out of that environment and put you in a place where you could naturally thrive and become the person you've become as well too. So,
and honestly, I do give a lot of credit to my mother, and God bless her. She was an individual that would work. She's still a workaholic, unfortunately, but she's always provided for her kids, has put her children first, and I really appreciate that too. And she knew that I needed to change, because if I didn't make that change, then I probably would have ended up behind bars
absolutely
on track that some other of my friends had.
Exactly. And I can definitely, I don't have the same story, but somewhat a little similar in terms of my parents making that commitment and investing in me and exposing me to things that, maybe others in my community weren't given the opportunity, which created this sense of empowerment in me that I could be whatever I wanted to be as a human being, and to pursue those things. And it was cool to be smart as well too. And in many cases, in some communities, that's not seen as a very positive thing. So again, commend your mom for making that commitment to you and your family as well. I did want to pivot a little bit too, and kind of piggyback on some of the things you shared just in your own journey of transforming your own healthcare organization to one that was arguably, not, on the cusp of being an innovative, technology-driven healthcare system, the one that's now very much so, and has received numerous honors in their effort to get there, and also having operated in a rural health environment. So I wanted to talk a little bit about those challenges that rural health organizations experience in your journey and today, as they continue to try to remain viable resources for the communities they serve. As you know, you hear every day there's a rural hospital that's shutting down or closing because they no longer can maintain, financial stability or meet the needs of that community. And share with us a little bit about, from your perspective, from your leadership perspectives, what are some of the current emerging challenges that your organization experiencing, whether it's technology driven or reimbursement driven or resource driven? What are some of the things that you guys are dealing with on a day-to-day basis? And then also talk a little bit about how you're approaching those things, how you're remediating those challenges.
Yeah, absolutely. So, first of all, I would really like to address, just rural health as a whole, on what I've seen the industry and what we've even we were faced with as well. The problem is these type of organizations have always had the brick and mortar theology really incorporated into their overall environment.
That's interesting.
A lot of specific smaller organizations haven't really looked at creating strong digital strategies that focus on business role, partnership, and then incorporating technology as a whole. And as I stated, COVID-19 has fully displayed the value of HIT innovation and digital transformation. Exactly. And the reality is that hospitals and clinics are digital companies that deliver healthcare services. We are living in the digital age of healthcare, and we must continue to incorporate HIT as a core component to the overall organizational strategy.
Right, absolutely. I was just going to comment also. When I was a CIO, I used to tell our executive leadership, every clinical, every administrative and business decision, that's financial decision that's being made in this hospital has a digital component built into it, has technology as an enabler of it. And so we have to always keep that in the forefront of any decisions we're making about these investments, because they are a key component to how we manage business today or how we take care of patients today.
And see, Chris, that's really the critical component there too. And rural health really suffers is because we have that established brick and mortar theology. And that's why I stated that hospitals and clinics are digital companies that deliver healthcare services. We need to act like a digital company moving forward. And that we realize that this isn't a technology makeover, but a business revolution to continue to transform healthcare and to continue to accelerate what we're doing with innovation. And the problem that I've always seen too is that IT, technology investments, have always acted as, especially IT has always acted as an order taker versus a value maker. And that becomes a major problem.
Yeah, expound on that a little bit more. And because I also have another perspective I want to share with you and see if you agree with it, but expound on that as well.
Yeah, absolutely. So, IT has always been the groups of saying, we're taking orders. They don't show it as really being a value maker. And then again, too, the reason why that happens is because IT technology investments, they have always been considered what? A cost center.
That's right.
This is a center that's basically impacting the overall organization. Mm-hmm. But ladies and gentlemen, we got to change that overall thinking.
Exactly.
IT no longer be considered a cost center, but a strategic revenue contributor. And that's basically the bottom line.
That's right.
We are a strategic revenue contributor that basically brings in revenue into the organization.
Exactly.
And if we had that overall mentality, and if we could tell the Flintstones to come meet the Jetsons, then we can really take the experiences gained from this unique challenge, and we could continue to evolve our industry, continue to invest in digital transformation. And that's really a critical element there too, is because look at what happened when COVID-19 came into place. A lot of these rural facilities, they didn't have their house in order. Mm-hmm. I say that is, some of their overall infrastructure wasn't up to par of what they basically needed, especially when people started going home, when they had to spin up telehealth clinics, when they, how do we continue to provide care outside the four walls of the hospital moving forward? So
let me stop you. Let me stop you there, because I do want to take that concept, and I absolutely agree with everything you said. That for so long, healthcare systems have looked at IT as an expenditure to the organization versus how we leverage IT as a revenue generator. But how much of that is the fault of fault is probably a harsh word, but I'm going to use it. The fault of the CEO and CFO versus the CIO being able to effectively articulate that?
Well, look at this though too. So, the thing is the evolution of the CIO has been one of those evolutions that have been kind of in the makings, because you figure in the smaller healthcare settings too, at the time, the CIO or, at the time, the director of IT didn't have a seat at the executive table, right?
That's true.
And this is really an evolution process of the healthcare CIO, from crawling to walking upright to really carrying the organization. Because you figure, when you started back then, you really started as a tech manager, and the tech manager in my really had like an advisor role. Okay. Right. So it looked at IT operations. Then you started kind of going into your CIO 1.0, which was basically more of a supportive role. Sure. It looked at being a vendor manager, project manager, asset manager, et cetera, et cetera. Then you had your CIO 1.5, which was more an enabler role.
Right.
This was a technology individual that understand the process, was really looking at process and visionary, really became a process consultant. And then you had your CIO 3.0, which basically was now put into the driver's role, had a seat at the table, basically became an overall project advisor, a venture capitalist, focused on customers, was an innovator in economics, a political visionary.
Right.
This individual driving different changes. But you figure that was a problem because with these smaller organizations, you really started, having that tech manager just focus. It didn't have that digital transformation initiative or that driver role, and it really depended on the personality of whoever was responsible for that too in these smaller organizations, that they didn't have that push of really defining what digital means to your healthcare organization too.
And do you feel like that's still the case today? In 2022, we're hopefully starting to flatten the curve on COVID now, getting back to the other side to some level of normalcy. You've had these healthcare systems who now have gone through some major transformation and adopting these technologies around telehealth and virtual care, analytics, et cetera. Do you see the CIOs within those rural health organizations, ones that have been able to transform the organization and start to think about it a little bit differently, or you still see them struggling with this as a longer term strategy and that CIO being that digital transformation leader?
Well, again, there's a big difference between a CIO and a transformational CIO.
Right.
I've seen that quite a bit with several organizations. And it's a sad situation.
Mm-hmm.
I don't know what needs to happen to get over that hump for these individuals to kind of look at change. And really the thing is how do we incorporate IT as that core component? How do we have a seat at the table to have full understanding of the overall organization as a digital organization and really create strong digital strategies that matter? And then again, too, technology and the reprioritization of IT really empowers the new era of healthcare because we know that technology has emerged as the driving force to achieve success.
Exactly.
And hospitals are digital companies that deliver healthcare services. We must get away from that brick and mortar theology and incorporate the digital transformational theology of defining what digital health means to your organization and incorporating, a digital strategy, as I stated, looking at the business as a whole, looking at the roles, the partnerships, and incorporating that technology is really critical, man. And we need that more than ever. And again, it is a disservice at times, too, that we see this industry behind the curve when it comes to the advancements of digital transformation. We should be leading the pack because what are we doing? We're doing the most important thing out there, and that's taking care of patients' lives. Right. I always say to my CEO too, man, I say, unfortunately, I have a new CEO. Okay, well, really, who's your new CEO? I said, my new CEO is the patient.
I love it.
And that's the bottom line, because honestly, if you think about it, the patient is the individual that's driving revenue to your organization.
Exactly.
Patient determine if they can go. Patients are now taking more care of themselves. They're taking more initiatives of,
They're more informed consumers.
No, exactly. And the thing is if organizations don't continue to build strong asynchronous tools that benefit the patients both inside and outside of our organizations, we will not be successful moving forward.
Absolutely. And with the advent of virtual care and other services that are providing healthcare outside the four walls of the hospital, patients are starting to have more options available to themselves too. And so, if they're not getting the type of care that they'd like to receive from these health systems, or those health systems are digitized in a way that allows them to do that, they are taking their business elsewhere. So to your point, you have to be a digital company that's providing healthcare in order to continue to deal with the digital natives that are out there and those of us who see the value in adopting this technology. I wanted to pivot real quickly too, just maybe you can share a handful of things as you think about what's some of the challenges that are happening in rural healthcare, whether it's workforce shortages or the distance and transportation challenges in rural healthcare or broadband access or lack thereof. Just maybe a couple of things your organization is doing, or even the state is doing in your role as kind of an advisor to the state to start trying to close some of these systemic gaps that are existing in rural health.
No, 100%. And, that's really critical. And I've been, honored to be a part of the actual commission and really helping redesign some of the actual IT roadmaps and some of the, the items that we're trying to do here in the state of Colorado. I've recently been also appointed to the commission's Rural Healthcare Committee as well too. So we're focusing on harmonizing and advancing data sharing and health information exchange capabilities across Colorado, and looking at how do we create specific assistance and grant opportunities to improve rural connectivity, which is so important too throughout the overall state. Equity for all. Really one critical that I am looking at doing, and I'm so passionate about rural health, is that we definitely need that equity for all as well too. How do we create better redundancy throughout our overall environment? I've been fortunate enough to design a really strong board gateway protocol, which basically is an overall network architectural process that really brings in true internet diversity and redundancy to MSRHC. And it's a huge thing. And we have been able to, so I designed a fully diverse and redundant internet connection. It's via a hybrid communication system compressed of 2 dedicated network microwave radio connections, fiber optic middle mile long haul connection to Denver, Colorado, to really enable a second diverse and redundant internet drain within the organization. And we received some special funding through USAC, which basically was a huge thing too. But you figure a lot of these organizations, we have to, especially as an actual commissioner for the state of Colorado, is really trying to determine how do we create a clear and easy to understand HIT package specifically tailored to the needs of rural providers when it comes to connection, technical costs, barrier, connectivity and integration, social determinants of health integrations, reimbursement, policy barriers for telehealth. These are all different items that we basically have to really focus on moving forward into some of the new roadmaps and updates that we're basically doing with the Office of eHealth Innovation for the state of Colorado. But being an overall committee chair for the Rural Health Committee is such an honor, because I'm really trying to leverage as much knowledge and try to help really, again, coordinate some good funding sources into really creating an overall easy to understand HIT package.
No, that's great. And it's interesting because what you've described is something that I've been saying for quite some time, is that technology is really the next utility. When you think about what you're building, that infrastructure that you're building, that all these health systems will be able to leverage, it's like kind of the next power grid, right? It's like the next water system, for Colorado. It's allowing these health systems to be able to leverage data under an infrastructure that it provides access to information that will allow them to provide better care. And so I always say now that technology is really the next utility. You can't run a hospital without power, you can't run it without water, and arguably now you can't run it without IT. And so right. So the work that you're doing today is laying that foundation that the health systems across your state are going to be able to benefit from, and hopefully commoditize the cost of technologies, just like we've been able to commoditize the cost of power and water within our own communities.
No, and that's really definitely a critical thing too. Just as you stated, we must continue to really position our organizations for success. And then what's also important too is using the patient's voice for change is also so critical to anything that we basically do, because that's why I stated that my new CEO is a patient. And we have to cater to their needs. We have to understand them if we expect them to have loyalty to our organization. And then also too, man, what I like to incorporate with this is sometimes, everyone puts their whole trust in the EHR. But we have to realize that the EHR isn't the center of the universe either.
That's
We
right.
have to look at the EHR, and we need a variety of tools to continue to really innovate and truly transform what we're trying to do here.
No, absolutely. And I'm glad you said that, because I share my own perspective on that. Every technology has a life cycle to it, no matter whether it was, the original 8-track tape to the cassette to CDs to now digital content. Every technology goes through this life cycle, and so should the EHR. It started out as kind of just a data repository for financial information, moved to providing some clinical value. Now it has to evolve, become a platform that allows a wide variety of stakeholders to be able to tap into that clinical information and leverage it in a way that they see fit, whether it's for surveillance or research or primary care or virtual care or financial, and business decision making. That EHR, the data that's in the EHR is the real currency. It's not the EHR in and of itself. They have to get better in the way we create the tool from a workflow standpoint, but the core functionality of it will continue to remain the same. It's how we wrap around it, these technologies and solutions and platforms that really extend it to a whole different set of constituents and provides a higher level of care and operational efficiencies for health systems. We could probably talk another hour or more on this topic, but we are coming close to the end of my time, unfortunately. I do want to ask you a couple of things, though. First of all, if you could look back, I guess 20 years ago when you first started this gig and started thinking about your journey and where you are today, what advice would you give yourself?
Honestly, man, I would say is be yourself, be unique.
That's good.
Proud of who you are and be proud of where you're from. I think that's so critical moving forward, because everything that we have established in life has really made us that person we are, and just be proud of it.
Absolutely.
And again, too, be proud of where you're from as well, which I think is extremely critical.
Exactly.
And
you wouldn't be the person you are if it wasn't from where you came from.
Amen to that, brother.
Absolutely. And so here's my rapid round of questions. I'm going to ask, just say the first thing that comes to your mind. Here we go. First, our favorite TV show growing up as a kid.
Favorite TV show was, wow. I guess I had so many favorite TV shows. I would say The Wonder Years.
Wonder Years, perfect. Favorite hobby or pastime?
Favorite hobby or pastime for me now is working out. I'm always at the gym.
Yeah, me too. Favorite artist, author, musician, performer, or all the above, whatever you want to share.
I really like, as a singer, Toby Mac, some great inspirational songs that have really stuck to my heart. Really enjoy his music.
That's great. One thing that's on your bucket list that you have completed.
So one thing that we completed from the bucket list. So we went to Hawaii. So that was beautiful. We wanted to look at some of the beautiful sights out in Hawaii. We went on a what are they called? Air balloon ride. So that was
nice.
Hot air balloon ride. There you go. Sorry.
No, that's okay. I have not done that.
Yeah, so that was definitely not the bucket. I've always wanted to do that, and it's absolutely. I mean, you go up so high, but you feel like you aren't even moving. You're just like moving slow. It's absolutely.
Yeah, I've actually skydived before, and I did have that kind of sensation when I did that. But I'd love to, not travel so rapidly towards the earth and enjoy it as well. One thing that's still on your bucket list.
So skydiving right there, man. So okay. I am now 37 years old. So I said when I turned the big 40, I'm definitely going to do that. So
an amazing
I'm giving
experience.
a little bit more time because, again, my kids are getting a little older. So then if something did happen, at least it'd be good to go from there.
And do it while your wife will still let you do it as well, too.
Exactly.
And the last thing, bourbon, scotch, brandy, vodka, or tequila?
I would say some good tequila.
There you go. Good man.
Some Patron. That's my style.
You cannot go wrong with a good bottle of tequila, for sure. Well, Michael, man, thank you, brother, for taking time out your crazy busy schedule to chat with me and share with the audience your journey and your perspective on rural health and leadership and just life in general. All of this intermingles in some form or fashion. And I admire you and the journey that you have at quite honestly, at such a young age. I didn't even realize you hadn't turned 40 yet. And so you're making major waves in, this industry, and you've got a long road ahead of you to continue to make many more. So I embrace that journey with you, and whatever I can do to support you in that effort, you can always reach out to me as well. Any final thoughts that you want to share with the audience?
No, thanks, Chris. It's honestly an honor knowing you, man. You're a phenomenal leader. I always watch what you're doing, and you're a great role model, man. And always trying to mimic you out there. So keep doing amazing things and keep being you.
Thank you, brother. I appreciate that. Well, that wraps it up, guys. Thank you again for taking time out of you guys' busy, crazy schedule to sit here and listen to us pontificate about life and business and just, the world in general. I really appreciate you as a continued supporter of this podcast. And as I've always stated before, your feedback and comments are always welcome. We can always improve on what we're doing. We'd love to learn from you, your thoughts and perspective about what we're bringing to the audience. So thanks a lot. Take care. God bless, and see you next time.
Thank you so much for listening to Straight Outta Health IT. We hope you enjoyed today's guest. For more unfiltered dialogue of healthcare leaders and influencers, be sure to tune in next week. For the show notes, transcripts, and resources, please visit Apple Podcasts, Spotify, or your favorite streaming platform. We invite you to give us feedback by reaching out to Christopher Cunny on LinkedIn, just searching for Straight Outta Health IT, and you'll find us. We are constantly having live discussions about diverse topics in the industry.